Lauren Sanchez is a prominent figure in the entertainment industry and the fiancée of Jeff Bezos. Her appearance has evolved over the years, prompting some to speculate that perhaps plastic surgery was involved. What types of procedures, if any, might she have had? Let's take a look and make some guesses. Estimated costs of potential procedures are provided at the end of the video. In her younger years, we can see here that Lauren has incredible hair density, both on the scalp as well as her eyebrows. She has nice youthful infrabrow fullness and a strong mid-face and lower face jaw structure. And it appears that she may have had a fuller nasal tip initially, and then perhaps at some point it appears that it got a bit smaller. It became a bit more narrow along the bridge as well as the nasal tip. Now, it's not completely clear, but this could signify a potential rhinoplasty procedure. The nose does mature sooner in women compared to men, and some will have rhinoplasty surgery as young as 14 or 15 years old. And some patients who had a nose job earlier in life end up regretting it because they say that if they waited longer, they would have decided that they didn't really need it. So there's always some risk in performing cosmetic surgery earlier in life. In 2002, at the age of 33, what I see here is that Lauren has a well-defined widow's peak at the center of her hairline. Also, the left side of her hairline appears to recede more than the right side. When you look at the hairline, you see a higher level on the left compared to the right, and the way that she styles her hair oftentimes will disguise this element, but asymmetry at the hairline and asymmetry in the entire face is very normal, and we all have it. Already by this age, she appears to be getting some neurotoxin into the forehead, glabella, and crow's feet to reduce the incidence of wrinkles or rhytids. Also, compared to her earlier years, I do see some signs of a potential brow lift procedure. The brows do look more lifted to me than they did in the past, and this appears to be more, to my eye, than what neurotoxin alone can create. Also, when I compare back to her original bony facial structure, it appears to me like there might be some signs of cheek implants at this point. Especially in the lateral cheek, it looks like they're more projected than they were prior. So even though she had some cheek fullness in the past, that emphasis on the upper lateral cheek wasn't there, and so now we see that more obviously. And we're seeing some signs of lateral lip fullness. Now, is this because of some filler like HA filler, or maybe because of some silicone injections? We know that micro droplets of silicone used to be injected into the lips to create more long-lasting fullness. And we recently discussed this at length in our analysis of Lisa Rinna and the changes that occurred with her lips, and she was very public about the use of silicone injections in the past. So in Lauren's case, the center part of the upper lip is thinner than it appears on the sides. And in 2003, at the age of 34, I'm seeing some gum show on smile. So she has full tooth exposure when she smiles, and you're seeing the gum line itself. I always look for this anytime someone is coming to me for a lip lift, because with a lip lift, you're going to accentuate that upper gum show. So if someone has it at baseline, you need to counsel them that that will get more obvious after a lip lift. In 2004, at the age of 35, it looks like the jaw is now a bit wider at the gonial angles. So I wonder if perhaps she had a jaw implant around this time. This would have given her a more boxy type of appearance, but one that is now more balanced with those upper cheeks. Also, the lateral lip volume now appears to be even further enhanced, and there appears to be more of it on the right side compared to her left. So I think Lauren has always had a really nice facial structure as far as the actual bony anatomy, but it used to be a less boxy curvature. But now what I'm seeing is that as you look at the cheek area and you look at the lower jaw area, there's a bit more angulation and prominence in those areas. And in 2005, at the age of 36, I see no change, and that's the same through 2009. And in 2010, at the age of 41, we're seeing some upper tooth show on repose, So when she just parts her lips, you can really see her upper central incisors as well as the lateral incisors as well. And here I wonder if she had a buccal fat removal, because the area underneath her medial cheekbones appears to be more hollowed, and that's approximately the area of where the buccal fat rests. Now, it could also be that she experienced weight loss, and that might explain some of the changes in the face. But when we see a more obvious depression in that location, we do at least consider the potential of a buccal fat removal. While buccal fat removal was really in vogue last year and the year prior, 2022, 2023, we have to keep in mind that this is not a new procedure and it's been around for a long time. So back in 2010, there were still people getting buccal fat removal. In 2011, at the age of 42, we're really seeing this central upper lip gap forming. Now, this is because the lateral part of the upper lip is actually touching first with the bottom lip. And so you have this central region that's thinner, and that allows for those central teeth to show more. Some people love this appearance and they feel that it makes them look more sensual, and that is definitely the impact that it has on some people. But some who develop this appearance actually look to reverse it. So some options include dissolving filler, especially if it's HA filler, in those lateral components. That's one way to deal with it. And another option is to actually have it surgically corrected, where the excess tissue on the lateral elements is removed, and that's called a lip reduction. In 2012, at the age of 43, I see no change, and that's the same through 2014. In 2016, at the age of 47, I wanted to point out here that Lauren has flawless looking skin, and she's really had that from a very early age and has been able to maintain that into the present. And there's lots of factors at play for how to optimize your skin, but of course, proper skincare is a huge component of that. Our products at Feel Confident pack in a lot of expensive ingredients, but offer them at more affordable prices. We really feel like they're a great solution for people who are looking to have that vibrant, radiant skin. So go check them out. In 2017, at the age of 48, I see no change, and that's the same through 2020. In 2021, at the age of 52, when I look at Lauren's cheeks, they appear to be even more prominent than they were before. So that, to me, suggests a possible cheek implant revision procedure. Remember, cheek implants are placed through an intraoral approach where the incisions are under the lip, so they're very hidden, and you can take an implant that you don't like because maybe it's too small, maybe it's too big, maybe as the face ages you need to increase the size. That's the case for some people, and as tissues start to sag. So if an implant is removed, it's done through that same type of incision. It's removed and then it's swapped out for potentially a larger type of implant, and it can also have a slightly different shape to adjust to some of the aging changes that occur in our face. I also think that around this time, Lauren may have had a facelift procedure. So it looks to me like the jawline is very tight. Not what you would expect in a 52-year-old, where there would probably be at least some laxity, and I think she did have some laxity in the years prior. Now it looks rather tight, and I do see some changes around the area right in front of the earlobe, where it would suggest that perhaps there's been a transposition of the skin lifted and pulled over. Now, this was obviously expert work. It's very difficult to detect, and yet it does appear like there may have been some modifications. Also, to me, the eyebrows appear to be more lifted than they were in the years that immediately preceded this. Now, a brow lift can be performed at the same time as a facelift. When patients think about a facelift, they often think that everything is going to be lifted. But in reality, when surgeons talk about facelifting, it's intended for the lower face and sometimes the mid face. If you're looking to lift the upper face, such as the brows, that's usually a separate procedure called a brow lift that can be incorporated into a facelift, but isn't necessarily done at the same time. It can be done before, or sometimes it can be done after to complement the procedure. Also, there's less heaviness in the upper eyelid region, which could suggest an upper blepharoplasty procedure. Remember that anytime a brow lift is planned with an upper blepharoplasty, the brow lift is performed first to see if there's still excess tissue that needs to be removed. Sometimes you end up removing less upper eyelid skin after the brow lift because the brow lift is going to take some of that skin and move it up. And so you may not have as much extra skin to remove. So it's going to reduce the amount of skin that needs to be removed, because if you don't do that, sometimes you can over resect and actually hollow out the upper eye, and that can lead to a more aged appearance. If you like these types of facial analyses, please make sure to subscribe to the channel if you aren't already. And turn on notifications so that you find out about these videos as soon as we publish. In 2022, at the age of 53, I'm seeing some signs of lip filler. And this is in addition to what she originally had, whether it was HA filler in the past or silicone, I don't know, but now she's probably getting some touch-up HA filler, and it is causing some degree of asymmetry. To me, the right side of the upper lip appears higher than the left side, and this can happen with HA filler as it does cause some degree of migration often, and even in the best of hands, even with the most experienced injectors, this is something that we often see where there's a little bit of asymmetry from one side to the other. Maybe some of the filler has spilled outside of the vermilion border, giving that type of impression. Once again, facial asymmetry is very normal and often something that's not exactly perceived, especially by ourselves, until it's pointed out that, hey, this eye is different than this eye, or this cheek is different from the other cheek, and that's very normal. And in 2023, at the age of 54, I see no additional change, and that's the same through 2024. And the total cost of these potential procedures is $390,000. What are your thoughts on Lauren's evolution? Are her looks a product of natural aging, or the result of some nip and tucks? Let me know in the comments below. And if you have any other celebrities that you've been curious about, let me know about that as well.